Welcome to another CBH production. This lecture is titled The ABCs of Team Leadership in Emergency Medicine. My name is Colin Hegarty. I am the Associate Residency Director at Regions Hospital Emergency Medicine Residency in St. Paul, Minnesota. Here's a brief overview of the presentation. We'll go over the importance of a team leadership curriculum for emergency medicine residents. I'll kind of go through the concept of how we came about with the ABCs of team leadership in emergency medicine. How did we create it and what is it? I'll show you the team leadership evaluation form that we are currently using. And we'll just summarize all of the key points from the presentation. So why was it important for us to create a team leadership curriculum? Certainly associated with our emergency medicine residency, we're very familiar with the progressive responsibility that happens throughout the years as an emergency medicine resident, eventually leading up to the ability to lead adult and pediatric medical codes and trauma teams. The RRC for emergency medicine has a requirement that residents have a sufficient opportunity to direct major resuscitations. In the 2008 Academic Emergency Medicine Consensus Conference, The Science of Simulation in Healthcare, one of the key recommendations to come out of that conference was to incorporate more leadership training for emergency physicians. When we checked around with what other residencies are doing currently, there's great variability in how residency programs go about preparing their residents for team leadership, ranging from very formal curriculums incorporating teamwork type courses and doing practice through simulation, to residencies that really didn't have anything formalized but just had a lot of observation of how faculty or senior residents would do it, followed by kind of on-the-job practice and training through their team leadership as senior level residents. All of these things led us to question if there's a better way to do it and to come up with something that we could really incorporate into our residency to teach our residents to hopefully better prepare them to be team leaders as senior level residents. So with that framework, how then did we come up with the curriculum that we developed at Regions Hospital? First of all, the team involved in this project included myself, Kelly Berenger, Jesse Nelson, Emily Binstead, and a student research assistant, Sharmila. And we started out by just doing a literature search and doing a PubMed search looking for emergency medicine and team leadership, emergency medicine and leadership. We really didn't find anything that was specific to emergency medicine in terms of literature out there with a specific existing team leadership course for emergency medicine or emergency medicine residents. Next, what we did was to look at a lot of the bigger medical teamwork courses that currently exist. These are courses such as Team Steps, Med Teams, Crisis Resource Management, which can be somewhat discipline specific, so there might be emergency medicine crisis resource management or anesthesia crisis resource management. And these are the kind of courses that currently some residencies are using those courses and some of the broad messages from that to teach their residents. There's small parts of those that reference some things about team leadership, but overall, those are really teamwork courses that are intended to be taught to all members of the team to encourage better teamwork, better communication for critical events, but are not specific to emergency medicine residents for team leadership skills alone. In addition to those teamwork courses, we reviewed other broad medical courses such as ACLS, PALS, and ATLS. And ACLS and PALS do have specific mention of some team leadership and teamwork traits and from those we took out some of the key points about team leadership. ATLS does not really have specific mention about team leadership, but does have some things about preparing your team that we used as well. In addition to these medical courses and the medical teamwork courses, we reviewed pertinent team leadership literature from other kind of high-stakes fields, such as aviation, subset of business, and the U.S. Army. And from this entire review, we took the best common themes from all of these courses and the entire review and added them to our experience throughout the years with team leadership in emergency medicine to ultimately create our new curriculum. So what are the ABCs of team leadership in emergency medicine? Before I get to that, one thing I should mention is that the reason why we picked ABCs is it's a similar format to a lot of other mnemonics in medicine and emergency medicine with critical care especially, and we felt for this project to get something that would be a little bit easier for people to remember and then follow would be key. So that's why once we did our research, we wanted to fit it into something that was an easy to remember, hopefully, structure, and that's why we picked the ABCs. So the A is for assemble, which is basically preparing yourself and preparing your team. And all these we'll get into a little bit more specifically here in the next few slides. The B is be an effective leader. C is for communicate. And D is for debrief. Now I'll just go through each one of those letters a little bit more in depth to go into some of the details about the key steps for each for being the best team leader that you can be in these critical patients. The A is for assemble, which again is really to kind of assemble your team, and it really has to do with preparation. So preparing yourself and then preparing your team, and also thinking about any kind of special things that your team may need to prepare for the given case, all go into the A for assemble. So preparing yourself is fairly straightforward. It can include just personal precautions, such as gown, gloves, mask, but also if you would need a mental aid to prepare for the case, if you know what's coming in, that may be useful. A good example of this would be if you know it's a pediatric arrest coming in, you may go to a specific program that you have on your phone or a computer program that you could print out, and specific to the age of the child coming in, maybe get your RSI medication doses or your PALS medication doses to prepare for the case that's coming in. Preparing your team, certainly if you haven't already done this from a systems standpoint, it's a good chance to get your team organized with clear roles about who's going to do what. If possible, let the team know, what you know about the case coming in so everybody can mentally get prepared for what their role and their steps would be for that specific case. If it's something where you're assembling the team and assigning roles, you may consider even giving specific kind of goals and first steps for the team members if there's things that you want to work on in general, or specific steps that you're going to need them to do to get the case started off right. If it's someone that needs to work on access, if it's someone that needs to be prepared with certain medications, certain equipment, things like that, to really articulate those goals and first steps for team members and help them be prepared as well. And then the last thing about being assembled and kind of being prepared is to consider any other special things that you may need for that specific case. So a good example of that would be if you know it's a trauma patient coming in hypotensive, you may want to ask for your blood to be there on arrival or to have someone go get it. Certain supplies that you may need if you hear about something with a case where you need something specific, you may want to ask for it ahead of time. And if there's any consultants you think you're going to need based on your pre-hospital information, it's a good chance to get them involved or to inform them of what's happening before the case arrives. So the B in the ABCs of team leadership is be an effective leader. And each one of these individual components is really important to being successful as a team leader. But certainly effective leadership skills are something that some people have, but some people can learn. And this list can kind of review some of those traits or things you should strive for that you can work on to try to really be the best leader that you can in those critical situations. The first part about being an effective leader that's important for the whole team in general is to just set a positive tone. I think that can go a long way to the best care that patient can receive, and hopefully by really enhancing the performance of your team members, as opposed to having a negative tone, which can have some negative effects on your team. Choosing an appropriate leadership style. As we did a lot of this research, this was an area that we learned quite a bit from the military on. And they really have many different leadership styles that they refer to, but two of the most pertinent we felt to medical team leadership would be the directing team leadership style versus a participating team leadership style. And really the best way to think about these, I think, is based on the critical nature of the patient, and that can kind of help you determine what you should be doing. So one example would be if the case is a patient that's actually fairly stable and you're really just trying to coordinate things to get them to the next step, which may be to the operating room or it may be to the CT scanner, but the case is really fairly stable otherwise, you may choose to do more of a participating leadership style, which means probably less talking and directing on your end, more just allowing your team members to perform their roles, to give you input as needed, and really to kind of coordinate. The alternate leadership style that I think of as being more important for the truly critically ill patient, where minutes and a time element is more crucial in determining outcomes. And that's the directing leadership style. Directing leadership style is when, as the team leader, you really need to step in and be very specific and clear with what people need to be doing to really get them doing it as quickly as possible and in the most efficient manner. Good example of this would be a really critically ill trauma patient, and being very specific with team members in terms of order of events, who's doing what the next steps may be, so everybody knows what the plan is going to be and really knows that you're in charge and you're going to be directing that code or that trauma situation. Again, that's probably the best use of that leadership style would be in the truly critically ill patients. If you use that type of leadership style on all of your codes or resuscitations, it may not be the best, because there are others where you really can do that more participating leadership style, letting your team do a lot and being more of the coordinator. So those are two things to remember in terms of thinking of the type of case and then picking that leadership style that you're going to do that would be the most appropriate for that case. As the team leader, certainly you want to maintain a global assessment and perspective when you're supervising and prioritizing activities. Don't get focused on either too many little things or on distracting things. You really need to be in charge of the resuscitation and really be thinking big picture, next steps, and supervise and prioritize. An effective team leader certainly always invites the ideas and input of their team, and then also to use that input to show people that you're actually listening and value their participation and input, and then incorporate that into the plan of care for that patient. This is something that I think for team members can be a really valuable thing and a valuable quality in a team leader. Once in a while, the team leader, especially on longer resuscitations, it's wise to periodically reassess the whole team structure and roles to determine if the number of people you have in the room are needed, if there are roles that need to be shifted around for whatever reason. And this is something that once in a while the team leader just needs to do during the resuscitation, which kind of leads us to the next one, which is using your resources wisely. So remember what you're doing in your resuscitation, your case, but also you have care providers that may be involved with other patients. So use resources wisely, both in terms of personnel and in terms of equipment. And then the last one is certainly you obtain support when needed. So if there's certain equipment you need it. If there's certain consultants you need to talk to or you need to have involved in the case, ask for them. So that's a key step in being an effective leader, is to know when you need help and know how to obtain the appropriate support that you need. So the next C in the ABCs of team leadership is communicate. And when people think about team leadership and they think about teamwork in general, certainly communication winds up being a big focus of those discussions. And here I just want to share a few of the key themes that we took out of our literature search with some of the big areas of stress in those high-stakes fields in terms of areas that you should really focus on to really pay attention to your communication, but also to improve it and hopefully help with those critical patient cases. The first part of communication to pay attention to and to focus on is to have real direct communication. This is an easy one to think of. I think a lot of times we've all been experienced with cases where people give orders out just kind of generally to the room or to the air. Let's give morphine. Let's get ready to go to CT. Let's call neurosurgery. And those are all things that people in the room might agree with and think are smart things to do. But in reality, it turns out to be who is going to do any of those things. So again, when time is critical and you have a more critical patient, the more direct you can be with your orders or requests, it will ultimately help you. So if you know the nurse that could give the medication, use their name or be specific to look at them and make sure that they know the order's directed to them. Same thing if it's someone that can go get a piece of equipment, that can go get blood, that can do a phone call for you. Make sure that you're very direct with who is going to do that task for you. The next part of communication is to be clear. As clear as you can be with an order or request, that will ultimately help someone. If it's an order for a medication, what dose, how fast do you want it given? Be very clear in terms of the order. If it's a piece of equipment and you know where to get it, you can even be very clear to direct them. I need this piece of equipment that's located in this area. As clear as you can make an order, it will ultimately help with your communication throughout the whole team, but certainly from a team leader standpoint, to get those orders to people directly and to be very clear. Closed loop communication, something that's stressed in every piece of literature on this topic that we can find, in terms of when you give an order, to make sure the other person acknowledges they received the order. When they complete the task, they let you know that it's completed. So essentially from the time you start with the order until it's finished, you're aware of all the processes and the steps. And this is very important. Sometimes you'll give an order and you feel like someone's going to do something for you and it never gets done. So maybe they didn't hear the order correctly. Sometimes they do something, but you never hear if it was done or what the results were. And these are all ways that it could affect the case. So having good closed-loop communication can be key. This is the kind of thing that sometimes the team has to practice, or sometimes as the team leader you can prepare your team ahead of time by talking about this before the case comes in, that when orders are given, you want people to repeat things back and let you know when they're completed. So a good example of this would be a medication in a code situation. If you know the nurse giving the medicines, you can say, Mary, I would like you to give 1 milligram of epinephrine IV push right now. And then Mary, the nurse, might say, I'm going to get 1 milligram of epi and give it IV push. And you say yes. When she completes that task, the expectation then would be that she would direct back to you and let you know that 1 milligram of epinephrine IV push has been given. So now in terms of being direct, being clear with closed-loop communication, all those things have been accomplished. And it can really help with your team leadership to know what's happening and to make sure things are happening very effectively and efficiently. Room volume. Sometimes as the team leader, there are times where the room volume just gets out of control, and you need to be creative in ways to kind of get things to calm down. At times we've been involved in codes where people will almost yell and tell people they need to be quiet. and it certainly is effective to do, but that's again a tone thing where in terms of how people might respond to that, it might not be the best. So there might be some more creative ways that you can effectively control room volume. Some of it can be if someone's talking to the patient, you can let the team know that people need to just bring their volume down so we can effectively communicate with the patient and let them know what's going on. A lot of times if you're going to give the team an update on the plan, it's a great chance to control the volume in the room where you can just tell people, hey, everybody listen up. I'd like to let you know what we're going to be doing. And typically that's going to get people to quiet down, and then typically that's just kind of a cue that people should maybe take their volume down a little bit, and also an effective way to let them know what's happening. Positive tone, again, with your communication as best as you can. Be positive in terms of how you're doing orders, requests, encouraging people, thanking them for doing things. It can just be helpful for overall team performance. Periodically reviewing the plan with the entire team. It's a nice way to go over what's going to happen from your end and make sure you're clear on what's going to happen. Go over things so your team knows next steps and what's going to be happening. And then also people can think a little bit about their future steps and what they need to do to prepare for those next steps as well. So it's a nice way to be a little bit more efficient with the case and with planning. Team members, you certainly want to communicate well with your team members, but you also want to listen to your team members if they have suggestions or ideas. It's something that you can encourage. Again, depending on the critical nature of the case, it's something that might be easier to do sometimes than others. But even in the most critical situations, somebody might have a suggestion or an idea that might be very helpful for the case. So if team members have suggestions, listen to their suggestions and then kind of give them feedback about what you're going to do based on those. So communication is key. I think it's a big area of focus for team leadership. I think when you have cases that don't go well and you look back, a lot of the times it can be specifically related to some of these communication areas. So it's something that I think practicing can help. I think it's something that doing some reflection and feedback after a case can help. But I think it's a skill that you need to do over and over and over again until it feels really natural to do this in those most critical situations. And I think it's something that you'll find can be really effective in making you out to be the best team leader that you possibly can be. So the last letter here in the ABCs of team leadership is D for debrief. Debriefing is something that I think a lot of people think of when they do maybe a simulation case and they get done with it and they debrief to kind of do some education about performance. And that's certainly one way to think of it, but for actual cases that happen in the emergency department setting, it's nice to create an environment where you can do debriefings, even if they're very short, after cases to kind of accomplish a few things. Certainly, number one, to get some focused feedback on the team leader's performance and how the case went in general. That can be very helpful. It's helpful for people to discuss, but it's also helpful from a team leadership standpoint and the team leader's standpoint, especially as a resident, to get that feedback to make some improvements over time or to keep doing things that went particularly well during the case as well. So brief feedback with as many team members as possible can be helpful, and to kind of debrief the case overall gives people a chance just to talk about what went well and what should be worked on in the future. And also just from a systems-based standpoint, to do a quick debrief after a critical case can be helpful if there's a systems-related thing that should be discussed that may be something that could be improved for future cases. It's a great time to have that quick discussion and then either remember that feedback to get to the right person later or relay it to the charge nurse or whoever it might be that could help for improving the systems with future cases. So maybe it's a specific case where there was a piece of equipment that was challenging to find or that you felt like should be in the room or stocked. And maybe that's the kind of thing to figure that out after and get that feedback back to your department so they can make those improvements for future cases would be helpful. Same thing if it's a systems-based thing in terms of how quickly maybe you could get blood into the room, and are there systems-related barriers that maybe could be improved to improve the performance to get the things that you need to be successful. So debriefing is something that historically we probably have not done the best job of immediately after medical codes or traumas in the ED, But to do a quick debrief can be very helpful for team leadership performance improvement over time and to get feedback. And it also can be something that from a systems-based standpoint can be helpful for your ED to improve overall systems for taking care of those critical patients. And lastly, it can just be a nice way to kind of just ask your team how things went and what they think we should do differently next time, or what we should continue to do if it went particularly well. It's a nice way, again, to just get feedback from your team and keep them involved as well. So with the ABCs of Team Leadership curriculum, we incorporate this into our resident education with simulation cases and through our conference schedule. And we also try to have separate sessions for the residents to just practice team leadership and focus on these skills and behaviors. As we do that, we created an evaluation form that is a combination of a self-reflective piece for the residents, where they evaluate the first categories: the assemble, be effective leader, communicate, and debrief section. And then they would hand it off to the faculty that was involved with the case to fill out the global rating score. And then if there's additional personnel involved, they can give comments as well down in the nursing feedback section. From a simulation standpoint, typically it would just be the resident filling out the top part and the faculty filling out the global rating score. In the ED, if it's a real case, and we can use this form as well when the residents work cases in the ED, either a trauma case or a pediatric or adult code, we encourage them to fill one of these forms out after they run those cases as well. And again, they would fill out the top areas, reviewing their assemble in preparation, reviewing their effective leadership, communication skills, and debriefing. And then the faculty would do this area here that is below the line to do a global rating scale. And then the nursing feedback typically would be a nurse that might be documenting during the case. They can give additional feedback as well. Typically what we do with this form then is go over it verbally with the resident, but also scan it in PDF form to keep in their file. With that feedback form, it's a two-sided piece of paper, and on the front is more of the evaluation side, but on the back side it essentially has a review of the critical elements of the ABCs of team leadership. So as a reminder for the residents to look these over, also for the faculty to look them over and give specific comments that match up to the ABC curriculum. That's why we include this on the back of the form. So the front of the form is the evaluation side. The back side of the form is just a reminder of what the curriculum is and what those triggers should be that they should be hitting for each category. So in summary, it's well known emergency medicine residents need to progress throughout their resident years to be able to take care of more critical patients and to be able to direct major trauma and medical resuscitations. To this point, it's been quite variable on how residencies have prepared for this, prepared their residents for this role. Therefore, we did a literature search, came up with this novel curriculum called the ABCs of Team Leadership, and have been using it now with our residents, incorporating into their curriculum and having the self-evaluation form available in the ED, but also with simulation cases with excellent feedback from the residents, as well as good feedback from the faculty as well about the ease of use and ability to give them focused feedback on this area. If you have any questions specific to the team leadership curriculum or our team leadership evaluation and reflection form, please get in touch with me. My email is cullen.b.hegarty@healthpartners.com, which is cullen.b.hegarty, Hegarty, at HEALTHPARTNERS.com. Thank you very much.